This is Dr. Louis Blevins of Pituitary World News, podcasting today from Northern California with another in our series of video reviews of interesting magnetic resonance imaging studies. This is a patient who's 35 years of age and was basically diagnosed at age 18 with amenorrhea and has been amenorrheic since. Over the recent years, she was diagnosed with hypopituitarism, and MRI in 2019 or 18 or 19 showed a lesion very similar to this one, and subsequent studies showed that it had progressed in size. So we see a couple of things on this image. First off, this is the area of the sphenoid sinus behind the nose. This is the back of the tongue, the top of the throat. This is the base of the sphenoid bone. And we see this lesion here filling the sella. It's got some dark spots in the middle, and I'll show you more about that later. You also get the sense of something up here as well. So when we flip through, here's another part of the mass here, the mass here, a hypo-enhancing area in the center, an enhancing area in the back part that could represent either ectopic posterior pituitary or something that contains protein such as blood or fluid, an oil substance, for example. You can see this lesion. I'm outlining it here with the arrow. Anterior to the brainstem, this is the pons basilar cistern here. Again, sphenoid sinus. So this lesion fills the sella, extends superiorly. It has this cleft in it that could be an area of necrosis or calcification. We don't have a CT to prove what that might have been. This was a presumed pituitary adenoma that had grown superiorly and was actually compressing brain tissue. It made its way anterior to the third ventricle. This is the third ventricle and the chiasmal recess. This is the lamina terminalis. And this area is where all of the thirst and osmolarity functions of the body are located. And in the wall of the area on the other side of this dark space containing spinal fluid is actually where the vasopressin secreting neurons are located. But this is a beautiful view of the lamina terminalis here. And of course, this is the corpus callosum up here. So this patient went to surgery, and she had a very interesting lesion called a calcifying pseudoneoplasm of the neuraxis. And I've done a lot of research in the literature. There's not, to my knowledge, been one reported that involved the sella and the pituitary that caused hypopituitarism. These things usually occur in the brain, but can occur anywhere along the spinal cord as well. And it's not really clear what they are. Some people think that it might be related to tumefaction, inflammation, or some reparative process. And it's not really clear what sets it off either. But it's not a tumor. It's an organized inflammation with bone tissue, calcified tissue, sometimes cartilage features as well, and other unusual cells. They're usually benign and sometimes can be totally resected, but this patient's lesion was amenable to just partial resection because of the very small blood vessels that are often in this region at the base of the brain. So there you go. Not everything is as it seems. Some patients have very rare disorders. This proved to be a calcifying pseudoneoplasm of the neuraxis. Once again, Dr. Louis Blevins of Pituitary World News. Have a wonderful day.